Hi, my name is Jana, and this is my response to Module 2, Discussion 2, Triple Aim and Consumer Outpatient Services in Healthcare. We were asked to answer 3 questions. What is Triple Aim? Why do we think outpatient services are so popular with healthcare consumers? And discuss our experience with outpatient services. The Triple Aim is a framework developed by the Institute for Healthcare Improvement, IHI, which I will discuss further in the following slide. It aims to optimize the healthcare system's performance by improving patient experience, improving the health of the population, and reducing healthcare costs. Essentially, providing better quality care at a lower cost to a broader population. The Triple Aim has evolved to also include goals such as the well-being of healthcare workforce and health equality. To improve the patient experience, Triple Aim focuses on the quality of care and individual patient satisfaction. Improving population health is the second aim. It addresses the health outcomes for a group and considers the social determinants of public health initiatives. Reducing costs is the third aim, lowering healthcare costs while maintaining quality. Targeting financial efficiency in healthcare delivery and aiming for sustainable spending. Here is an example of 3 aims, missing in action. Molly is a single mom of 2 kids. She works a full-time job and is responsible for getting her kids to school and completing all the tasks of the household, cooking, cleaning, bills, etc. Molly has type 2 diabetes and cardiac issues since she was a child. She pays for her medication and is diligent with taking her medications on time every day and monitors her blood sugar with test strips. Molly had her budget down to a science for food, rent, electricity, and other bills. Halfway through the month, her mom has a healthcare crisis and moves in with Molly and the kids. Now she is paying for food for 2 adults and 2 kids. Food insecurity is now a problem. Holly feeds her mother and her kids because there isn't enough food to go around and she skips meals. Molly takes her medication anyway and ends up admitted to the hospital with hypoglycemia. Now Molly will have hospital bills on top of the food scarcity, and now she cannot pay for her medication. Food insecurity will likely not be addressed by her provider, and neither will her social determinants. The 3 aims will not be achieved. Patients need better access to care, coordination of services across the healthcare continuum and beyond, and focus on preventative care to avoid costly interventions. Noted from their website, the Institute for Healthcare Improvement, IHI, is a leading, globally recognized not-for-profit healthcare improvement organization that has been applying evidence-based quality improvement methods to meet current and future healthcare challenges for more than 30 years. IHI provides millions of people in healthcare with methods, tools, and resources to make care better, safer, and more equitable. Experts are available in sharing and helping with peer learning, and advises health systems and hospitals of all sizes in improving their systems and outcomes at scale. I found quite a few of their offered courses interesting, including this one, Leading Quality Improvement for Managers. The class description reads as though it's for entry-level management for the healthcare field, offering skills, tools, and resources needed for healthcare leaders to effectively lead quality improvement efforts at their place of employment. There are many courses that would be beneficial to anyone who has direct reports, including healthcare administrators. In order to answer the second question, why do you think outpatient services are so popular with healthcare consumers, the difference between inpatient and outpatient services should be explained. Outpatient services are when patients receive care and go home the same day. Outpatient can also include diagnostic tests such as blood draws and imaging, short treatment, or a procedure at the hospital, clinic, or similar facility. Common outpatient surgical procedures are things such as tonsillectomy or a gallbladder removal. With inpatient, patients stay in the hospital overnight and receive food and lodging. Inpatient care is often used for serious conditions that require monitoring, repeated treatment, or additional time to recover. Major surgeries could include cardiology surgeries, recovering from a heart attack, or even childbirth to keep an eye on mom and baby those first couple days. The shift to outpatient care is increasing, and experts expect that trend to continue. The shift from hospital-centric to patient-centric care is financially beneficial to both patients and healthcare providers. While the population of the U.S. is projected to grow by 22.5 million people between 2020 and 2030, 3/4 of the population growth is age 65 and older. Medical encounters will most certainly rise. Despite these growths in population, inpatient admissions are expected to decline by 0.9%, and outpatient is expected to grow 20%. There are likely a multitude of personal reasons why someone might prefer outpatient to inpatient services, but there are a few very common reasons. Outpatient centers are more accessible and more convenient. Outpatient services allow patients to receive care without needing to stay overnight in the hospital, which means less disruption to their daily lives and work schedules. Reasonable, transparent pricing draws in patients. Generally, outpatient procedures are less expensive than inpatient stays, which can be a major factor for patients concerned about healthcare costs. Patients also enjoy faster access to care. Often patients can get appointments for outpatient procedures much more quickly than for inpatient procedures, leading to faster diagnoses and treatment while minimizing time away from work and home. Also, there's improved technology. Advancements in medical technology have allowed for many complex procedures to be performed on an outpatient basis, which previously might have required hospitalization. This leads to patients feeling they have a higher quality of care. I have worked in many outpatient settings. I've worked in a GI procedure center that provided colonoscopies, endoscopies, and the like all day. It was amazing how many patients would pass through that center daily and how fast the clinical team had the dance down. The dance was very similar to an oil loop center. Sign in, hand over control of the vehicle, get the service, and the car waits around until you get there to drive it home. And after cleaning and maintenance of tools, the next car comes in. The cleaning part is a bit more involved when it comes to humans, however. I currently work at Seattle Children's Hospital, and the Seattle location has both inpatient and outpatient procedures. However, the surgery center in Bellevue is outpatient only. A majority of the surgical departments, general surgery, otolaryngology, urology, gynecology, and many more, prefer to do their minimally invasive procedures there. The providers, staff, and family all boast about the quick turnaround times and efficiency. For example, where a simple urology procedure would take a total of 2 hours in Seattle with turnaround time, it may only take 45 minutes to an hour in Bellevue due to their proficiency. As mentioned earlier, major surgeries that require inpatients, such as heart bypass, organ transplants, or patients with comorbidities, may be required to be seen at the main Seattle campus. If a surgeon requests an outpatient procedure to be seen at the main campus, it's usually due to the patient being more complicated and having more resources available on main campus in case things get more complicated than expected. Some patients are admitted and require post-operative monitoring and recovery, which is not offered at the Bellevue location. Most patients and their family report positive experiences with the outpatient services, citing the convenience of being able to go home the same day as their procedure and the ability to recover in the comfort of their own home, and generally shorter wait times for appointments. Due to the shorter procedural times, surgeons are able to do more procedures for patients in one day, which means getting their child's procedure in Bellevue sometimes months sooner. Some patients and their families sometimes do express concerns about the need for proper follow-up care after an outpatient procedure, especially if they have complex medical needs or if the caretaker isn't confident in their ability to follow post-op directions. As a patient, I much prefer outpatient procedures. I've been both a patient, inpatient, and an outpatient. While an outpatient, the only thing I can think about is being home. I never get fully comfortable without having my bed and my home, and I disliked having staff coming in so frequently that I was unable to sleep, as I'm an extremely light sleeper. If I had the choice, I'll always choose outpatient. Thank you for listening.